So happy to be with you all today, and also I'm here with Dawn Flitcraft. I'm excited to have her with us. Dawn, welcome.
Happy to be here with you, Warren.
So Dawn, could you introduce yourself real quick to the group, just in case folks don't know you, and
Absolutely.
Then we can go a little bit from there?
So when the opportunity came to me, I believe back in 2019, to serve potentially on the Inspira board, it was something that really hit home for me. I am local to the area. I live outside of Elmer, and so having this opportunity to volunteer and serve my community and give back, being a board member, has really fulfilled that purpose and that drive and that mission in me to give back to my community, but also keeping the patient and what we can do for them at the heart of everything that I do.
You know, access to care obviously is a huge component for us, and we're sitting in a great example of that. We're here in Millville. We're in our brand new, not open yet, otherwise we wouldn't be able to sit here and talk today. This is a almost 10,000 square foot family medicine practice. It creates incredible access for our community here. This group of providers was in a space about a third of this size, and we've just grown so quickly. So now we have the ability to serve the community today and for many years to come. We've been up to some really cool stuff lately as an organization, and I think for a lot of folks, really understanding how leadership and the board of trustees, how closely we work together. We work on our vision and our future, and we talk about what our plans are for growth, and then we put that plan in place. And you've been so much part of our most recent iteration, going through the planning process. And so can you talk a little bit about one or two projects that we're doing or have done recently that you're most excited about?
First off, with our strategic initiatives, we've talked a lot about focusing on accessibility of services to Inspira's geographic location. How can we bring different innovation? How can we bring different technologies to the patients that we serve? We're also very focused on our workforce. We want to make sure our team, the Inspira employees, feel supported. We give them the tools, whether it be continuing education, availability to feel secure, supported, and be able to grow their careers with Inspira. And then finally, obviously, and this is important for us as a board, we've got to make sure we're financially responsible. Obviously, when we did the demographics and we were planning Mullica Hill years ago, I don't think any of us expected the population increase that we have there now and the need to be able to accommodate that. And that speaks wonderfully, to the Mullica Hill area and the influx of especially families that are moving to the area that we have to be able to provide care to. We've formed wonderful partnerships to be able to provide advanced expertise for patients with needs in neurology and cardiology. Our maternity services and our maternity ward at Mullica Hill, again, has experienced tremendous growth, and we have to be able to expand those areas. And then finally, we are very proud to have the residency programs that we have across all of the Inspira network.
I think that's a sort of secret that a lot of the state doesn't know about Inspira, is how large our teaching program is. We'll be approaching, when we cap out next summer, almost 300 residence slots. I love being part of that.
Absolutely, because it's just, while we'd love them all to stay at Inspira, and obviously some of them will, think about the impact Inspira, because of teaching those doctors of tomorrow, the impact Inspira is having across our region. So it's a tremendous, tremendous, wonderful thing. So those are exciting things when you think about meeting the medical and physical needs of our community. But as you know, we experience and have seen a lot of needs from a behavioral health point of view. It is a national epidemic. I think it's fair to say all of us in some way have been impacted by it. When you look at that, and we opened Bridgeton, right? So we have additional beds there now to serve the community from a behavioral health point of view. We will obviously be looking at Mannington, and we just were in Woodbury, adding beds there. And any additional services we can offer from a behavioral and mental health point of view. You know, those on the outside may say, well, why are you putting so much emphasis on that? But as we've heard from the community, tremendous need, but also from our staff.
Yeah.
When those individuals walk into our doors, it takes a lot of time and compassion and patience to work with them. These aren't just access points, right? It's in the community. That's a differentiator for Inspira. We talk about the growth that we've had across the network, more patients coming into our doors. At the board level, the executive team, Amy, yourself, you know, wonderful collaboration, but we know it's our teams on the front lines. It's every individual, whether it's the person, the registrar checking that patient in, or the physician that they see going through our ERs. It's that experience that they're having from the initial touch point and making sure the patients feel they are heard, regardless of all of the things around it that keep them coming back and spreading that positive news. So we have a lot of work to do ahead of us, and it's a joy to do it and to also be involved with the Inspira team. So thank you.
Yeah, and thank you, Dawn, so much for spending the time. Likewise, it's an honor for me to work with the Board of Trustees. It's so committed to our communities, our employees, and our mission and our vision. So thanks again. I look forward to talking to you soon.
Right.